Good morning, good morning, good morning. I'm Dr. Dale Dangleben, and on behalf of Patient Choice and Shimen Point Michelle, this is the medical tidbit of the day. Before I get it started, you know what's interesting? I get a lot of messages on WhatsApp and Facebook Messenger, even from folks who are not my friends, and most of it is positive. But a lot of people are coming in and saying I preach gloom, and I think that's very interesting because I think that's one of our problems is we don't want to know, right? We don't want to know. But I say the key is education, and remember that knowledge is empowerment. You can take what I'm saying and do with it as you please. It comes from the heart. What do I want to talk about today? I want to talk about statins and muscle damage in black patients, right? And the muscle pathology is called myopathy, right? And the statins I'm talking about is things like simvastatin, atorvastatin. These are the cholesterol lowering medication that many people take, right? So black patients experience more muscle pain and muscle damage when taking those medications, especially atorvastatin and simvastatin. Okay, and again, we're not going to bury our head and because people take those medications. All right, and these are the most widely prescribed drugs in the world. Yes, they work. They lower cholesterol, they protect the heart, and save lives. But like every medication, they come with risks. And that's what I'll be talking about for the rest of the week, some of these medications and your risk. And one of the most important risks is statin associated muscle symptoms. And it's not the same across all races. Okay? Black patients report higher muscle toxicity, especially with the two medications that I mentioned. And there are several studies that show that black patients have higher rates of statin associated myopathy. That includes muscle ache, weakness, ongoing cramps, and in rare cases, muscle breakdown. That's called rhabdomyolysis. Okay, I know these are big terms, but again, we have to learn. We have to educate each other, right? And the ones I'm talking about, atorvastatin, which you might know as Lipitor, and simvastatin, which you might know as Zocor, right? Why do they cause these symptoms? There's genetic differences in metabolizing the drugs, all right? And that's the key. It's genetic differences, right? Many black patients have a higher baseline muscle mass, right? And that seems to increase the sensitivity to the drug-related injury, right? And if you combine the statins, the Zocor and Lipitor with certain blood pressure medication, then that even worsens the toxicity. And again, these are tidbits, so you have to, if you're on these medications, it's okay to learn more about them. Okay, I'm not saying to come off the medication. That's not what I'm saying, right? Okay, I talked about vitamin D a while back, and one of the things that plays a role here is vitamin D, right? And I talked about this. We have a misconception about vitamin D. Black patients have increased skin melanin, which produces less vitamin D from sunlight, right? And we have more vitamin D deficient, right? Upwards of 80%. It's very common, right? So low vitamin D levels make the muscles more vulnerable to inflammation, cramps, and injury. And if you combine low vitamin D with the statin, you increase the muscle pain, doubling it. All right, so these are the kind of things that we need to know. So if you're taking statin, you might as well take a vitamin D supplement. All right, I'm not saying to stop using your statin. They save lives, especially in our community where heart disease is common. But we need to monitor and we need to protect and we need to know better. Okay? Now, there's a new set of statins, the pravastatin and the rosuvastatin. They have lower muscle toxicity. All right? So, again, these are the things from a doctor perspective. You need to talk to your patients about these things. And if they have complaints, and you can do the proper lab work, including a CK level. Check vitamin D levels. Make sure that they're not deficient at baseline. Watch for the early signs, right? If you start taking this medication, all of a sudden you develop muscle pain that you never had, shoulder pain, back pain, unusual fatigue, your urine starts getting darker. Pay attention to these things and do not ignore them. And doctors, when your patient tells you about these things, take them seriously. Okay? So remember, I am not saying to stop statins. They're powerful medications, right? But not everyone processes them the same way. We're more likely to experience problems. So the solution to the doctors, choose safer statins, early monitoring, correct vitamin D, and listen to your patients when they say my muscle hurts. All right? These are important things. Treat the whole body and don't depend on just one or two medications. Weight loss if you're morbidly obese, if you have a genetic predisposition, and familiar, just pay attention to these things and take your medication, okay? But at the same time, continue to educate yourself. I have to go. Have a great day. Peace.